good evening and thank you for joining us on this Facebook Live today. As you know, Medfin is redefining the future of surgeries in India by offering the latest surgical procedure at affordable prices. Medfin also offers latest daycare procedures which ensures lesser pain, lesser hospital stay, and of course, quicker recovery. Medfin, we work with top surgeons and state of the art medical facilities to bring the best care to you at affordable prices. Think surgery, think Medfin. And without further ado, I would like to introduce our doctor who's with us today. Dr. Shailesh Rohit is an interventional radiologist, is one of the very few interventional radiologists in India. He was trained at the prestigious University Veer Narmad from South Gujarat and in radio diagnosis and did his fellowship in neurovascular and interventional radiology from Manipal University, Bangalore. His specialty interests are vascular, neuro, oncological, and non-vascular interventional radiology. He has performed more than 3,000 vascular and non-vascular interventional procedures. And welcome, doctor. Thank you for joining us in our session today. We
Thank
only
you.
have we only have about 30 minutes, so I would like to start off with the questions. First one is, what is uterine fibroids? We hear this quite often. So if you can explain what it is to us.
Yeah, first of all, thank you very much, Meghna, for your kind words. And yes, we'll not waste the time and we'll go on the question first. Yeah, so uterine fibroid. So uterine fibroid is very common disease in the female, and yes, it is a tumor, but it is not a cancerous tumor. Okay, so it is a non-cancerous tumor, and it is occurring within the wall of the uterus. Okay, so this is what uterine fibroid is.
Mhm.
Okay.
And what causes the uterine fibroids?
Yeah, so there are multiple causes of the uterine fibroids, but the main causes of the uterine fibroid is one is genetic.
Mhm.
So if in family uterine fibroid is there, then there is a chance that it will get into the subsequent generation. But yes, that percentage of the penetration is not 100. It can be 50, it can be 60. In some, it cannot be there also. Okay, so that is one thing. Second thing is the diet. When you are having very much starchy diet and people are obese, in that case, yes, it can happen. One thing is estrogen hormone. Okay, so when we are taking pills, oral contraceptive pills, then yes, if you are taking this oral contraceptive pills for a long time, then yes, it is one of the reason to getting fibroid.
Okay.
And after that, age factor.
Mhm.
So fibroids can occur in reproductive age from age of 13 or 14 when females are getting their menstrual period. Okay, from till they will get menopause. But majority of fibroids are symptomatic during 35 to 45 years of age group.
Okay. Is there a specific group of people who are prone to this more than the others? Like it could be lifestyle or it could be occupation. Is there anything like that?
Occupation, I say occupation has not a major role, but yes, lifestyle is having a role
Mhm.
because when people are getting obese, okay, so that is one cause of the fibroid. Second thing is alcohol, smoking. So these are lifestyle, right? So yes, it can modify our hormonal balance and all, and then it can cause fibroid.
Okay. And what are the symptoms, doctor? When would somebody recognize that they might have developed fibroid?
Yeah, so symptoms, there are various symptoms,
Mhm.
but we can divide symptoms like this when it is local to the uterus and symptoms because of the pressure on the surrounding structures. Okay, so when uterus is there within your pelvic cavity, so first of all, uterus can cause heaviness within your pelvis. It can cause some uneasiness within your pelvis.
Mhm.
Third thing is when you will have periods, during that time it will cause a more bleeding.
Mm-hmm.
Okay, so if you are having some 3 days or 5 days of menstrual that this thing days you are getting bleeding, it can increase the days of the bleeding. It can increase the amount of the bleeding, and sometimes it can cause a abnormal bleeding, like in between the cycle, in between the month, you will
Mm-hmm.
get a bleeding. Okay,
Okay.
so these are the localized symptoms. Above that, it can cause a pain. And when it will enlarge in the size, when it will enlarge the uterus, in that case, it can cause a compression symptoms. So there are surrounding structure like our urinary bladder, okay, urine cavity. So when it will cause compression on the urinary bladder, it can cause the symptoms of the urine. So sometimes it will increase the frequency of the urine. Sometimes it can cause the urinary detention also. Okay, and when it is if it is giving compression on the rectum. Rectum is the part which is the distal end of your alimentary tract.
Yeah.
Okay, so you will get a symptom related to passing stool. Sometimes you will get constipation. Sometimes you can cause it can cause these all varicose symptoms also. Your veins will get distended, and then you will get bleeding through the rectum, and all these things can happen. So these are all symptoms. Majority of the symptoms are related to bleeding and heaviness.
Okay. While we are discussing all this, I would like to tell our audience that if you have any questions for the doctor, please feel free to drop a message on our comment section, and doctor will answer back with all the replies to you. So please put your questions in the comment section. And the next question would be around what are the different kinds of fibroids? Are there different kinds of fibroids, doctor?
Yes, yes, there are different type of fibroids. It is mainly that classification is on the location of the fibroid. So I'll say what is uterus. So uterus is like a cavity. Okay, so this is a cavity. Okay, this is the organ where it is having a wall. It is having a cavity. It is a womb. Okay, so there is a cavity in between. This is the exterior part, and this is a wall, and this is the interior part. Okay,
Mhm.
so depending on that, if it is just below the internal lining, it is a subserosal fibroid, submucosal fibroid, sorry. Yeah.
Mhm.
And if it is the within the wall, it is an intramural fibroid. And when
Okay.
it is the outer side of the wall, it is a subserosal fibroid. Okay, so there are three types of fibroid, and one more variety is there, which is a pedunculated fibroid. That means, okay, if it is hanging into the cavity, then it is a pedunculated fibroid. So when it is hanging within the cavity, sometimes it is hanging outside of the wall. Then those are pedunculated fibroid.
Okay. Uterus being the reproductive organ in a female, these fibroids, can it cause infertility? And which type of fibroid would cause infertility?
Yeah, so infertility, there are two types of fibroids which can cause infertility. One is the submucosal fibroids, which are, means I told you that classification of the fibroid, different type of fibroids. So the fibroids which are submucosal, which is uh,
Just at the
towards
line?
the cavity, towards the cavity. Okay, so it can cause infertility. The other fibroids which are subserosal, when it is causing obstruction of your fallopian tube, from where the ovum will come. Okay, so it can cause an obstruction towards the travel of the ovum. In that case, it can cause an infertility. And these fibroids which are submucosal towards the lining,
Mhm.
there our fertilized ovum will implant. Okay, so if it is not having a good environment there, then there is a chance that it will get miscarriage. So repeated miscarriage can happen because there is not a good environment for implantation of the fertilized ovum. In that case, yes, it can cause a miscarriage, repeated miscarriage.
Okay, okay. Thank you, doctor. And next, talking about pregnancy. When a woman is pregnant, are there possibility chances of developing fibroids during pregnancy? And how harmful is it, or how would it affect?
Yeah, so it is a nice question. And yes, so during pregnancy, the thing is, during pregnancy, first half of pregnancy, like 3 months or 5 months of the pregnancy, where hormones will increase in the amount in the body. So all these fibroids are happening because of the hormones. Okay, so when increase in the hormone, it can cause increase in the pre-existing fibroid. So if it is there within your uterus, then it can increase in the size during that period.
Okay.
But particularly if I say, okay, because of the pregnancy, fibroid is happening, then the chance is very less.
Okay. And what are these fibroids made up of? Is it accumulation of something? Is it like calcium-based stones, or what are the fibroids made of?
So fibroid is a tumor. It is majority of fat tissue and the tissue of the uterine wall. So I cannot say entire pathology to the to you, but yes, at the same time I can say majority of thing is fat, and
Oh,
these uterine wall, they are very responsive to the hormones, to the estrogen and the progesterone. So when it is increasing, that estrogen content within the body, it is increasing, it is stimulating this fat within the uterus, and it is causing increase in the size, and it is forming there.
okay, okay. So how are these recognized? How do one recognize uterine fibroid?
Yeah. So first of all, because if female is having symptoms, as I told you before, if the symptoms are there, so that is the first point. So whenever you will get symptoms, yes, you should consult your gynecologist, or nowadays you can consult for interventional radiologist also, who are very well knowledgeable about this female reproductive things and all. So you can go to interventional radiologist or you can go to gynecologist, and they will do examination, a local examination, per abdomen examination, and then per vaginal examination. In those examination, we will find that your uterus is been enlarged in size, and there is a irregularity in the wall of the uterus. By that, we can find out, we can have a suspicious of having a fibroid.
Okay.
And then for confirmation, we can have a radiological test. Like one is ultrasound,
Mhm.
so which is the most common test and cheapest also. So we can go for the ultrasound, and then in ultrasound, if we are getting a diagnosis, then it is good. Okay, and then if we are not getting a proper diagnosis in ultrasound, then the best test for diagnosis of fibroid is MRI.
Okay. Okay. Thank you, doctor. And from what you've said, I understand that the fibroid treatment depends on the size, the location, and the severity. But what are the various treatments available for uterine fibroid?
Yeah. So coming to the crux of our our
Passion.
discussion, there are many options because from long time these problems are there with the females, and there are traditional treatments, there are new advanced treatments, and there are many treatments which are happening all over the world, and it is there in India also now. So one thing most common is happening in India is hysterectomy. They are removing the uterus. Okay, you remove everything, you are free of the disease. But actually, that is not the best. Yes, if you want to say, okay, there is a fibroid and something is bothering you, you remove that thing and then it is gone. We are not doing the same thing with our brain, right? If there is a tumor within the brain, we are not removing entire brain. So there is no point to do all these things. So hysterectomy is a gold standard. It was the gold standard once upon a time, but it is not right thing to do. So we should approach all these things step by step. So yes, medicine are there, hormonal treatments are there, But yes, we cannot use hormonal treatments for long. If we are using hormonal treatments for long, what will happen? It will decrease the calcium within your bone. So you will get osteoporosis. In 40 years of age, if you will get osteoporosis, then because you want to treat your fibroid and you are jumping in some other problems. So you don't want that, right? So that is one thing. Medicine is the one treatment, but it is not advisable for a long time. Second treatment is myomectomy. Okay, so what is myomectomy? So gynecologists, they do myomectomy. They are removing fibroids, particularly they are removing fibroids. They are not removing entire uterus, but whichever fibroid is giving you a symptoms, those fibroids they will remove. So at a time, they cannot remove all the fibroids, but they can remove one fibroid or two fibroid. But yes, having said myomectomy is there, but it is not a treatment uh, which you can undergo every time. Like they will do that myomectomy for your symptomatic fibroid, but they will not remove your all fibroids. So whenever again you will get symptoms, again they will remove that fibroid, whichever is causing you a symptom. So again and again, you cannot remove that small part of your uterus. And there are multiple side effects also of the myomectomy, like adhesions will be there because you are entering into your abdomen again and again. Then some adhesions will be there. That adhesions will give you a pain again and again. It
Right.
will cause infertility also.
Mm-hmm.
So that is not very much advisable, but yes, results are good. Third thing is uterine fibroid embolization.
Right.
Okay,
That is
so
the main intention of our call also today for the session. So if you can throw more light about that, that'll be helpful.
yes, now we'll talk about uterine fibroid embolization. So what we do in uterine fibroid embolization, it is a very advanced treatment. So from over the years, all traditional medicine, now in we are in modernization of our medicine, where there is no requirement of cut and all, and
Mm-hmm.
we can treat the disease without cutting anything, without removing anything. Okay, so uh, we can say, okay, we don't have to damage anything what God has given to us. We are here to treat it. We are not here to remove it. Okay, so we will what we will do is in groin we will put a small nick. So that nick will not be a proper incision. It is a nick of size of tip of our refill pen. Okay, so through that we will go inside your vein, and then whichever artery, whichever vessel is supplying that fibroids, okay, we will block that vessels. We will block the flow, blood flow to that vessels. So if we will cut that flow, we will cut that supply, then it will shrink in the size. It will shrink in the size over the time, and it will not give you a symptoms. So that's way we are working in uterine fibroid embolization. And because it is very minimal invasive, so idea of having this surgery is because it is very minimal invasive. We are not cutting anything. We are not entering with all our instruments into our abdomen.
True.
So uh, blood loss is minimal. Anesthesia requirement is like nothing. Like there is no requirement of anesthesia per se. Sometimes when people are like, some patients are very apprehensive. In that case, we are giving some sedation. Okay,
Okay.
patient will be drowsy a little bit. That's it. Otherwise, we
Mhm.
are not giving major anesthesia. And
Okay.
mostly we will do procedures under local anesthesia only.
Mhm.
So blood loss is minimal. Complications, there is no complications. Okay, so that's what people need.
True.
Right?
Thank you. I wouldn't have even heard about this procedure, which is so simple and lesser pain. And who can get the uterine fibroid embolization done? Like, is there any restriction on whom you can administer this treatment?
Yeah. So there are indications. because all patients should not undergo uterine fibroid embolization. So if
Okay.
it is very large in size, if it is more than 10 centimeter in size, okay, in that case, we are not recommending uterine fibroid embolization. We can go for the procedures. That is not an issue. But the thing is, the symptoms remissions will not be much. So we will not get a good result.
Okay.
If it is less than 7 centimeter in size, if it is the type of the fibroid I told, intramural fibroid and submucosal fibroid, okay, which are the major, the percentage of the fibroid which are giving symptoms. So these fibroids, if it is less than 7 centimeter in size, then yes, you can go for the uterine fibroid embolization. And if you are having symptoms, then only we will do uterine fibroid embolization.
Okay.
And in which we should not go. We should not do uterine fibroid embolization. The patients who are having pregnancy, okay, so during pregnancy, we cannot go for the uterine fibroid embolization.
Okay.
If uterine fibroid is there and associated some cancer of the uterus is there, some like cervical cancer, cervix cancer is there. So in that case, we should not go for the uterine fibroid embolization. Some patients which are having allergy to the contrast agents or allergy to some drugs, in that case, we should not go for the uterine fibroid embolization, because when we are injecting drugs to see that uterine fibroids under cath lab in operation theater, so that time it will be difficult because patient will be in allergic reactions. So we cannot go for the uterine fibroid embolization. And one more thing, which is not absolute contraindications, but it is a relative contraindications when your kidney function is not good. Okay, in that case, we have to, if it is required, if it is very much required, we can do with some other methods like carbon dioxide. We used to inject carbon dioxide and then we find out which vessels are supplying that. Okay, and then we can inject that particles inside. But we should not use contrast agent in those patients where kidney is not functioning well. Okay,
Okay.
so these are some contraindications.
Thank you, doctor. I would once again like to remind our audience, if you have any questions, please leave it in the comment section and doctor will reply to all your questions. And next question is around how long would the procedure take? And how soon can somebody resume back to work once the procedure is done?
I say take a vacation of 5 days and then you are back to work. Okay, so I can elaborate this thing. So if you are having symptom, okay, you come to OPD, and then in OPD we can consult all the things and we can do all the investigation on OPD basis only. And when you come for the procedure, so this procedure will itself take around 1 hour, not
Okay.
more than that. Okay, and in 1 hour we can do procedure. Patient will not be under anesthesia, so patient will be fine when she'll come out of the OT. Patient will be fine. That day, patient will have some painkillers. Okay. And if next day, after 24 hours, if patient is having pain, vomiting and all, then we will keep patient one more day into the hospital. And then after 2 days, we will discharge the patient. 3 days, patient will have some pain, some cramps. For that, patient will be there on antibiotics and some painkillers. But yes, after 5 days, patient will not have any major pain and major symptoms.
Okay. Okay. So it sounds pretty simple compared to traditional operations where they'll have to spend days together resting and recovering from the surgical pain.
Exactly. In a modern
And
world,
yeah,
time is money.
absolutely. And how long does it take to recover after the procedure? You said like within 5 days they can come back.
Yeah, so
So,
after 5 days, patient will not have any major symptoms, but yes, sometimes pain and cramps can be there, just like you are getting, pain and cramps on the second day or third day of the menstruation. The same kind of pain can be there. Sometimes patient is having vomiting till 10 days. Okay,
uh,
not all the time, but yes, once in a while, patient can have vomiting. Okay,
Oh,
but patient will be on the tablets. Okay, for first 10 days.
okay.
Uh, but after 5 days, she can resume all work and everything.
Fantastic. And what is the probability of getting these fibroids back
So it is
after
always a
a
debatable question. It
okay.
is always a debatable question. Uh, Normally, after 2 years, first 2 years, patients are not getting any recurrence.
Mhm.
After 2 years, when in procedure itself is like, we have discussed, okay, we are cutting supply of the blood to the fibroid.
Mhm.
And we are not denervating blood supply to the uterus. We are cutting supply to the fibroid. Okay, so later on, what will happen? These fibroids, we are not removing it. So later, after 2 years or 3 years, it will again recruit a blood supply from surrounding wall and all. Okay,
Mhm.
but having said this, 15 to 20 percentage, 15 to 17 percentage, I'll say, according to literature around the world, 15 to 17 percentage of the cases after 2 years, they will get that fibroids back. Not similar size, not of similar size, but yes, it can come back after 2 years.
Okay.
And again, all fibroids are not causing symptoms. So when it will come back, it is not like that all 15 to 17 percentage of the fibroids
Mhm.
which has come back, all will give symptoms. Okay, so out of that, some 1 or 2 percentage or maximum 5 percentage can give you symptoms. Okay, so
Mhm.
the chance of recurrence is negligible, I think so.
Is there anything that could be done to reduce the recurrence? Any steps, any precautions, preventions?
Yeah, so you should, healthy lifestyle is always better. You should not be on alcohol. You should not be on smoking. You should have a better food like green vegetables, fruits, and some Ayurvedic people, they are telling turmeric has some advantages over that,
Mhm.
but I'm not doing research in all those things. But yes, turmeric has some advantages over that. And vitamin D is having vitamin D. It is proven on in all scientific papers. Then,
Mhm.
if it is vitamin D level is good, then you can prevent it.
Okay, thank you, doctor. And again, this might be a fear for those who them who have fibroids. Can that turn cancerous? Can fibroids turn cancerous?
Yeah, so cancer is these tumors. First of all, these tumors are not cancer. It is non-cancerous tumors. Okay, and if fibroid are there in a long run, it can convert into the cancer. That is a question, but that chance is point one. So in 1,000 cases, one case can be like that.
Mhm.
But majority of the literatures, they are telling, okay, if you are having fibroid and it is converting into the cancer, that chance is very, very, very less. It is one identity, one this thing is there. Uh, we are calling it leiomyosarcoma. So this fibroid's name is leiomyoma, and
Mhm.
when it is a cancer, it is a leiomyosarcoma. So
Mhm.
these sarcomas are not actually fibroid, but it is stand-alone tumor.
Okay.
So it is originating on itself. It is not like there is a fibroid and it is converting into the leiomyosarcoma. It is not like that.
Mhm. Okay, okay. Thank you, doctor. Before I move on to my next question, I would like to tell our audience if you would like to book an appointment with Dr. Shailesh Rohit, please call us on 7026 200 200. And all of us know at this time of global pandemic, you might be scared to come into the clinics, but you can be assured that we ensure a risk-free treatment, and the video consultations are also offered, or you could walk into any of the Medfin clinics because it is a risk-free zone. We take all precautions and measures to make your experience risk-free. Before you go into the surgery, there is a list of protocols that are followed to make your experience risk-free. Fever screening is done before you enter a hospital, history of past illness, fever, smell test, chest x-ray for patient and the attender, travel history is taken, location check, people from red zones are not allowed, check with Arogya Setu app, and only one attender is allowed per patient. So all of this together is made to ensure your experience and your treatment is risk-free, and you also have a faster recovery. Doctor, coming back to uterine fibroids, can these fibroids affect menstrual cycles? And how can they affect menstrual cycles?
So menstrual cycle, yes, it is related to menstrual cycle. So menstrual cycle is all about changes in the hormones, estrogens, progesterones. So whenever estrogen peak is there, yes, this fibroid will increase in size and all. So how it is affecting your cycle? Definitely, it will increase your bleeding. First of all, when if fibroid is there, it will increase days of the bleeding. It will increase the amount of the bleeding.
Mhm.
Okay, so yes, it is bothersome. It
Mhm.
will change your menstrual cycle.
Okay. And what happens if these fibroids are left untreated? Like somebody just assumed that it is normal to have all these symptoms, or what happens if it is avoided?
Yeah, so if fibroids are there, if some females are there, they are going for health checkups and then they are getting some fibroids. Okay, and then they are not having any symptoms.
Mm-hmm.
They can just they can have some normal work as it is. Means that they don't have to go for the treatment. If
Okay.
they don't have symptoms, if they have symptoms,
Mm-hmm.
if they have symptoms, it is bothering, then definitely they should go for the
Okay.
treatment.
Okay.
So treatment options already means I told you that treatment options and all. Uh, and the other extreme is like uh, 45 years of age group and 50 years of age group, you will get menopause. Okay. So when menopause will be there, these fibroids will shrink in the size.
Okay.
Okay, it will not bother you
Mm.
after menopause.
Okay.
So if it is bothering you during 35 years, 40 years of age group, and if you are okay with that bothering lifestyle, okay, you don't go for the treatment. That's fine. But then
Okay.
quality of life is always important, right?
True.
So I prefer, okay, if you are having symptoms, if it is bothering you, your quality of lifestyle is hampering, and then because of the fibroid, it is chance that you will get anemia.
Okay.
Okay, and when anemia is there because of the bleeding and because of your blood will be taken by this fibroid,
Mm-hmm.
there is a chance that there is a high chance that anemia can happen. And anemia is what? It is your red blood cells are decreasing, right? And then it will not be available to other organs like brain, to liver, to your heart. Everywhere blood cells will not be available. When blood cells are not available, okay, all other organs also will hamper. So your quality of life is going down and down. So if you are having symptoms, if you are having fibroid, you should undergo treatment.
Right. Thank you, doctor. And are polyps and fibroids same?
Polyps and fibroids, no, they are not same, they are different. So I told you before, uterus is like a cavity.
Right.
Okay, so there is a inner lining. Okay, so from that lining, something is originating within the cavity. There is a stalk, and then it is protruding towards the cavity,
Mm-hmm.
and it is originating from the lining. Then it is a polyp.
Okay.
Fibroid is a tissue which is originating from the wall. It
Okay.
is not originating from the lining.
Okay.
Lining is what you are shedding during the menstrual cycle. That is a lining.
Mm-hmm.
Okay. So, and polyp is cancerous sometimes.
Okay.
Chance of getting cancer into that polyp is very high, and in
Fine.
fibroid, it is negligible.
Okay. Thank you, doctor. And can uterine fibroids burst?
Sometimes, yes, but the chance is very less. But if it is large in size, then
Mm-hmm.
it can burst, and we should not wait for that. If it is very large in size,
Mm-hmm.
if it will burst, in that case, it will be the emergency.
Okay.
And emergency is not such an emergency where you will go to some gynecologist, some OPD, and then you will get treated. It is a die-hard emergency where bleeding will be so much, and you should have a facility of good operation theater, interventional radiologists. Then only it is possible to get it treated.
Okay. Okay. And the last question is around taking care, prevention, and what could keep uterus healthy? What kind of food habit? What kind of lifestyle? If you can quickly tell that.
So as I told you before, if you are having alcohol, if you are doing smoking, you should avoid it,
Right.
right? And you should not have any starchy food and all.
Mhm.
It is there. It is also a part of the our food habits, but then you should not have more. And always you you should not have that obesity and all.
Yeah.
Okay, you should control your weight,
Mhm.
and that is there. And green leafy vegetables are good.
Okay.
Fruits are good. Legumes are good,
Right.
right?
Thank you so much, doctor. That was absolutely informative, and I'm sure a lot of women and girls are benefited out of this. Thank you so much for joining